In 1879, a British doctor traveled deep into the heart of Africa, expecting to see simple herbal remedies and basic treatments. What he found instead left him completely speechless. In the Kingdom of Bunyoro-Kitara, he witnessed a surgical procedure that would have been considered impossible in Europe at the time. A healer worked with precision, skill and knowledge that rivaled, and in some ways surpassed, the best Western medicine of the era. Minimal bleeding, almost no pain, and a recovery faster than anything this Victorian doctor had ever seen. For Robert Felkin, it was a moment that would challenge everything he had learned in medical school. But what happened next would shock him even more. Before we dive into the main story, like and subscribe to our YouTube channel and click on the bell notification button for more interesting video like this. In 1879, the world of Western medicine was very different from what we know today. Europe was in the midst of the Victorian era, and medicine was dominated by ideas of germs, sanitation, and the very early stages of surgical procedures. Anesthesia was still primitive, antiseptics were only just being introduced, and any form of surgery was considered extremely risky. It was in this world that Robert William Felkin, a British medical missionary, set out for Africa. Felkin, trained in European medicine, had already encountered various African cultures through missionary work, but nothing could have prepared him for what he would witness in the Kingdom of Bunyoro-Kitara, located in what is now western Uganda. Bunyoro-Kitara was one of Africa's most powerful kingdoms during the 19th century, with a long history of organized governance, trade and surprisingly sophisticated medical practices. When Felkin arrived, he expected to see traditional remedies and simple herbal treatments. But what he actually saw challenged everything he believed about the limits of surgery and medicine. One day, Felkin was invited to observe a medical procedure. According to his detailed journals, the patient was a man suffering from a severe abscess in his abdomen, a condition that, in Victorian England, would have almost certainly been fatal. But the Bunyoro healer, known as a herbal doctor, demonstrated a combination of skill, knowledge, and techniques that seemed almost miraculous to Felkin. The procedure began with careful preparation. The healer used a combination of herbal antiseptics derived from local plants, some of which modern science now recognizes to have antibacterial properties, to clean the area. Then, using specialized knives and finely sharpened tools, he performed an incision with precision. What astonished Felkin most was the speed and calmness of the healer. There was no screaming, minimal bleeding, and remarkably, the patient remained conscious and responsive. Felkin described the moment as a defiance of everything I had learned in my European training. In his journal he wrote, "I watched, transfixed, as the healer worked with a calm authority, knowing exactly where to cut, where to cauterize, and how to prevent infection. It is nothing short of astonishing that such knowledge has been developed here without the libraries, universities, or textbooks of Europe." The healer then used a mixture of herbal poultices to promote healing and prevent infection, something Felkin could later confirm as having genuine medicinal efficacy. Even more surprisingly, the patient recovered rapidly, much faster than Felkin had seen in European hospitals at the time, where postoperative infection often proved deadly. This experience stayed with Felkin for the rest of his life. It challenged his assumptions that Western medicine was inherently superior and opened his mind to the value of indigenous knowledge systems. He would later write extensively about African medicine, emphasizing that European doctors had much to learn from these techniques. Felkin's observations in Bunyoro-Kitara in 1879 are now recognized as an important historical moment in medical anthropology. They highlight a truth often overlooked, that African kingdoms had highly developed, sophisticated medical practices long before colonial intervention. The story of Robert Felkin and the Bunyoro healer is more than a historical curiosity. It's a lesson in humility and recognition of global knowledge. It reminds us that innovation does not belong to any one culture or continent, and that the human quest to heal transcends geography and technology. By witnessing this procedure, Felkin became one of the first Europeans to document African surgical expertise in a serious, scientifically respectful way. His journals, published later, influenced both missionary work and the early study of African ethnomedicine, laying the groundwork for modern recognition of traditional African medical practices. So the next time you think about medicine in the 19th century, remember, while Europe was still experimenting with rudimentary antiseptics and anesthesia, in the heart of Africa, in Bunyoro-Kitara, skilled healers were performing procedures that could rival, and sometimes exceed, the best that Western medicine had to offer. And just when he thought he had seen it all, the healer revealed a secret technique that no European doctor had ever witnessed before. Something so advanced, it would forever change how Felkin viewed medicine. Stay with us to see the procedure that defied science itself. For more videos like this, like and subscribe to our YouTube channel.